The latest on the coronavirus, cases top 20,000, first U.S. patient released. Second part. This means the CDC advises travelers to avoid non-essential travel to Wuhan, China, previously identified as the epicenter of the recent outbreak. According to the CDC, Chinese officials have closed transport in and out of Wuhan, including buses, subways, trains, and the international airport. Preliminary information suggests older adults and people with underlying health conditions may be at increased risk for severe disease from this virus. Person-to-person transmission has been confirmed. Officials admit they don't know the source of this virus, and we don't understand how easily it spreads, and we don't fully understand its clinical features or severity. According to a report in China state media, tighter regulations will be imposed on vehicles leaving the city. Additionally, vehicles are banned from taking passengers out of Wuhan, and measures including body temperature monitoring of drivers and vehicle disinfection will be implemented. Tests rule out MERS and SARS. According to the WHO, initial information about the pneumonia cases in Wuhan, provided by Chinese authorities, points to the coronavirus as a possible pathogen causing this cluster. Chinese authorities later reported that laboratory tests ruled out SARS-CoV, MERS-CoV, influenza, avian influenza, adenovirus, and other common infectious agents. More than 8,000 people contracted the SARS virus, and almost 800 died in the 2002 pandemic. The SARS virus spread to nearly 40 countries in 2002 and 2003. The same type of virus was associated with a similar outbreak of MERS, which was first identified in 2013 in Saudi Arabia. According to the WHO, MERS has been responsible for about 850 deaths worldwide. Coronaviruses are a large family of viruses, with some causing less severe disease, like the common cold. Although some easily transmit from person to person, others don't. Chinese authorities have confirmed that the virus in question can cause severe illness in some people. Infection linked to the local food market. China state media reported that some of the people who fell ill between December 12 and 29 are sellers from a local wholesale seafood market. That market has since been shut down for cleaning and disinfection, according to the CDC. What's happening over there is in a particular area of China at a seafood market, and it first appears that transmission is from animal to human. Nikhil Bayani, an infectious disease physician with Texas Health Resources, told us. Chinese authorities turned to quarantines to stop the outbreak. China has started to shut down flights and trains from Wuhan, effectively quarantining a city of millions, according to reports. This started during the Lunar New Year holiday, when tens of millions of people often travel home in China. According to an earlier translated report from the Wuhan Municipal Health Commission, experts advise that the city is currently in the season of the high incidence of infectious diseases in winter and spring. Citizens should pay attention to maintaining indoor air circulation, avoiding closed and airless public places and crowded places, and wear masks if necessary. Sud said, any infection anywhere in the world is always a risk for every country because international travel has become so easy now. He adds this is why early detection and quarantine are essential measures in halting the transmission of these infections. No treatment available. According to Sud, human coronaviruses most commonly transmit from an infected person to others via the air by coughing and sneezing, close personal contact, such as touching or shaking hands, touching an object or surface with the virus on it, then touching your mouth, nose, or eyes before washing your hands. In the United States, people usually get infected with common human coronaviruses in the fall and winter. However, the infection can occur at any time of the year, he said. Most people will get infected with one or more of the common human coronaviruses in their lifetime, he added. Sud also points out both SARS and MERS outbreaks were from animal to human contact, with SARS most likely from contact with bats and MERS from contact with camels. Since the organism causing an infection is a virus, to date, we don't have any specific antiviral medications, Sud said. The bottom line: Chinese authorities have identified an outbreak of respiratory illness. The CDC has issued a Level 3 warning due to the outbreak, notifying travelers should avoid non-essential travel to the area. So far, 11 people in the United States have been confirmed to have contracted the new coronavirus. This week a patient in the U.S. is going home after recovering from the virus. Research has revealed a coronavirus caused the infection, a common type of virus that can also cause the common cold. Experts emphasize that since a virus causes the illness, there aren't any treatments available. The infection can only be allowed to run its course. This report prepare from different news group and media groups. Thank you for watching this video.